Good afternoon, everyone, and welcome to the COVID-19 Survey Working Group. It's a delight to be back with you today and to be back into our conversations as a group working on these topics of public opinion research and public polling and survey research. We've taken a bit of a hiatus here to allow people to recuperate and recover a little bit over the course of the pandemic, but we're glad to be back with 2021 edition and to be able to continue our conversations about the methodological aspects of COVID-19 survey research. I'm also really excited for the session because I think it does a good job of transcending some of the boundaries that we have in terms of the different sectors and areas of expertise that have worked on this research. Many of our working group members may be things like researchers from the academic sphere and from social sciences and humanities. But there's been a huge amount of public polling and public opinion research from those domains occurring here as well. And I can't think of anyone better to discuss these issues with us than Gary Langer, who is a longtime polling director with ABC News. And has been heavily involved both through Langer Research as well as through the Sean Network in terms of helping to aggregate and make accessible and bring together a wide array of different polling research. And so Gary today will be able to talk to us about a couple of things. We'll spend some time discussing Sean as a venue, and then we'll draw on his expertise and his experience in COVID-19 survey research and some of the work that he's been doing himself. So with that, I think we'll get started here and give Gary a chance to share some of his work. And then we'll have an opportunity to have some Q&A and discussion as we go forward through that. If you are joining us live on YouTube, I encourage you to leave your comments in the chat. If you're here in real time, I'll be able to ask those forward. And otherwise, we'll incorporate them into the conversation and flow as best we can. So with that, Gary, the floor is yours, and would love to hear from you about the work that Sean has been doing and that you've been doing on COVID-19.
Thanks, Eric, and thanks everyone who's tuning in. I appreciate the time to talk with you. A couple of things I'm going to talk about. One is the Sean COVID-19 Survey Archive and Weekly Survey Summary that we produced. And the other is some primary research we produced for an organization called the COVID Collaborative, a nonprofit engaged in organizing response efforts to the pandemic. I'm going to hit the screen share and jump into some slides. I'm going to talk through a few. I'm going to show you something online. First, we'll do Sean. We'll take a break, get some questions, and then we'll jump into the primary research we've conducted. I'm going to hope and trust that you're seeing the slides.
Yeah, Eric, that's great.
Fantastic. Okay. Now we're talking about leveraging the data that we have in front of us. So Sean, the Societal Experts Action Network, as you can see on the top there, their logo, is an organization convened by the National Academies of Science with support from the National Science Foundation and the Alfred P. Sloan Foundation, to bring together social science experts to marshal intelligence from the social sciences in support of the pandemic response. The COVID Collaborative, I'll talk about a little more later. Sean has really two fundamental missions. One is to connect policymakers with social, behavioral, and economic research that relates to the COVID-19 pandemic. And the other is to share this research with a broader audience, including the research community, policymakers, the news media, and the public at large. And that's where we come into that piece of it. We created, through the National Academies and then in support of the National Academies, through the National Science Foundation, the Sean COVID-19 Survey Archive. It's intended to be a one-stop shop for essential survey research into the pandemic. You know, you might have noticed there's been a few attitudinal, behavioral, social, and economic surveys on the pandemic, like an endless flow of them over the last months. And it can be overwhelming. Frankly, it can be really tough to get our arms around it. There's so much we can learn from this research, but first we need a way to get at it in a comprehensive, but also streamlined and focused way, so we're not just drowning in data. Using an application that we operate commercially called PARC, Project Archive. It's a cloud-based application to search and retrieve survey materials in an expedited, very focused fashion designed for the survey research enterprise. open access, simple to use resource that can find individual survey questions and all related materials, reports, data tables, data sets, scripted questionnaires necessary for replication, and all the other documentation we can obtain. As I mentioned, it's housed on our knowledge management platform called PARC. Currently, the collection all the way back to February of 2020 includes more than 950 probability-based surveys from the United States and 35 other countries, and well over 11,000 individual questions and many, many thousands of associated files. The question we had is, would anyone share their data with us, right? All the organizations that produce these data tend to hold on to it at least for some time. But we reached out to many, many of the leading survey research shops in the United States and many internationally as well, and said, look, we need to come together as an enterprise in response to this pandemic. The research we're conducting is critical. It's important to share it, to open it to secondary analysis. We'd like you to donate not only your reports, but your top lines, your data sets, your questionnaires, all the material that you can share with us. And all these prominent organizations have shared right up to the full data set level. Others contribute materials, but not data sets. And all we have more than 100 contributors globally to the archive. And we're honestly grateful for their contributions. I'm going to jump in. You can find the site there, but I'm going to stop this screen share and take you to the COVID site. Well, let's just take a look at it. Eric, we're good there?
That looks great.
Fantastic. So that's covid-19.parc.us.com. This is the landing page. I'm going to tell you a little bit in a second about these weekly summaries, but first, we can hit the search engine here, and we can search any survey question we want. Let's say we're interested in vaccines. I'm going to type the word VACC, asterisk, makes it a Boolean search, so vaccines, vaccination, etc. Hit search, and we can find very quickly there's, 510 individual survey questions since the beginning of the pandemic that have asked about the vaccines. If we want to see the answer to any of them, we can click on results, and we're the smartest guy in the room. We know how many people say in the latest APNORC survey that they've received a vaccine, etc. Importantly, over in the survey file here, we can click on the folder for any given project and find all the related files that we've been able to obtain associated with that project. There are charts, in this case, crosstabs, the top line, and indeed the data set in SPSS format. So if you want to dig into this file and do secondary analysis, it's at your fingertips. And this is true for these many, many hundreds of surveys you see there. If you are searching questionnaires, say you want to replicate some of these questions, rather than look at the top lines, you can see specifically how they were asked. You've got the coding, the programming, any related material. So if you want to replicate these questions, you can grab them, you can click it, download it, and assemble, if you will, a shopping cart full of questions that you want to go out and replicate. You can search analyses as well. Any written report. And analysis is any documentation we call an analysis. It can be a memo, a written report, further data, you name it. And we can see the word vaccine appears in them. This one's Google Translate. It's interesting. This is, I believe, a Russian survey from a company called Vitsium. It's the largest polling shop in Russia, and we can see that they've got 30% of Russians surveyed positively assessed. Right. So again, it's a world of data at our fingertips. We can restrict the search to using the advanced search function to specific geographic areas or survey modes and all the rest. It's really an invaluable source, I think, of data. We want to know what public attitudes are about masks because we're trying to assess acceptance of mask wearing. We can find those questions, as you see, 430 individual questions going back in time. I'll mention as well, 430 questions can be a lot to look at. If I hit project only, instead of seeing, well, I'm sorry, that's analyses. Let's go to top lines. Look at how many questions we find. 280 individual questions. If we hit project only, instead of seeing every question with the word mask in it, we see every project with a mask question in it. And associated with each project is some of the paradata here, tells us some of the background and a link to the source. That's the Sean archive. And then I mentioned earlier that we do these weekly summaries as part of it. Let me stop this screen share. I'll go back to my slides. I'll tell you a little about that. Okay, and we're back on the slides. Great.
Looking good.
Terrific. Okay, since these data are all going through our hands, right, we're vetting and curating the surveys that come to us. We take probability-based surveys only because that's necessary to support inference. Since we're looking at all these data, we produce a weekly summary of key results from social science studies released during the previous week. These are an example of the topics. We had intended when we started that this would be sort of a 2 or 3 or 4 pager each week. It turns out to be much longer than that because there's such a wealth of surveys being produced. And on a weekly basis, for example, this past week's study started out this way. Our survey summary started out this way. And it didn't stop there. There's the full report that we put out. These go out about 11 a.m. every Friday. We try to spice it up with some charts, and every study we cite includes a link back to the survey source. So this is another really good way of getting our hands around all the data that's out there. This a weekly update of the past week's newly released survey data on the pandemic. If you're interested, you can sign up for it at the covid19.parc.us.com site, and you can see more about Parc at that URL. That covers the Parc section of the talk. So I'm going to hit the stop share again. And let's just pause and see if there's any questions I can answer about the Sean archive and summaries that we produce to see how they can best serve your research needs.
Absolutely. Thanks so much. And just as a reminder, if you're joining us live on YouTube, I am watching the chat and comments there. So feel free to type in your comments and we'll get those asked. I've got 2 broad set of questions that I want to draw on here. And maybe we can start with the bigger picture and then get into a little bit more of the mechanics of Sean. But the bigger picture here is one of the things I've been grappling with during the pandemic is the relationship between academic survey research on the pandemic and public polling and public opinion research and political polling and those kinds of issues. And so given that a lot of our working group comes from an academic background, I'm wondering if you can just tell us a little bit more about some of the sources of data input into this. Who are the big players? What are some of their priorities in terms of the questions they ask and how they're asking them? Just give us a bit of an explanation as who are of the public opinion side of COVID-19 research.
Sure. I might mention there's a couple of good resources that are provided and linked to on the site I just showed you. There's a contributor's guide, which describes our criteria for inclusion in the collection. And there's a fairly lengthy Q&A article in the journal Survey Practice from last summer that gives a good explanation as well of the effort. So, I don't, in SBE, social behavioral and economic research, I don't draw a lot of distinction between academic researchers and researchers in the public sphere, except that academics often don't use the best methods, to be perfectly frank. So if you did a survey of 47 of your students in Social 101, it ain't going to make the archive, right? We're looking for random sample probability-based surveys. I'll say an enormous amount of survey work these days is done using convenience samples, non-probability samples. We're personally not religious about survey methods, but we do want to use and report and leverage data that support inference, that are valid and reliable. And we've closely followed the literature. And to date, the literature do not support the notion that non-probability sampling produces data that are reliable and valid in terms of supporting inference. So we don't include them in the archive. And that excludes quite a lot of stuff that academics seem to be in many cases happy with. But I would suggest that those who are take a closer look at the literature. So we use random sample telephone surveys. We can use random sample face-to-face surveys if any such are conducted. Those are generally limited to developing countries these days. And we use probability-based or random sample online samples. The GFK, now the Ipsos Knowledge Panel the NORC, AmeriSpeaks panel are good examples of probability-based online panels. Those are ones in which the recruitment is done not online, but through address-based sampling. As far as what they ask, they run the gamut. There are many really strong survey organizations, of course, in the United States, internationally as well. I don't want to just talk about the US data, but I'm most familiar with it, if I may say. The Kaiser Family Foundation is really a leader in healthcare-related survey research, and they've been putting out quite a lot of very strong work. The Pew Research Center does good work. Ipsos itself, through its partnership with a news organization called Axios, has been putting out weekly or biweekly surveys on vaccine uptake. There's, of course, the Gallup organization does a lot of work. The major television networks put out a lot of surveys, as do academic-based survey research institutes, the Marist Institute of Public Opinion, the Monmouth University Survey, Quinnipiac, and others as well. There's really a wealth of data and approaches in there across every subject you could possibly imagine. And we think it's important not only to get the numbers and percentage signs out there, but to do so in a way that enables policymakers, fellow researchers, and the public to organize and access them in a structured way. As I say, otherwise we'll just be wallowing in a sea of numbers, a mass grave of figures and numbers. This gives us the opportunity to really focus our research and produce the secondary research we're interested in.
I'm curious about that because it's been a theme in some of our conversations has been the idea of knowledge mobilization and evidence-based decision-making. Are there examples that you could point to from COVID-19 where you've seen survey and polling-based research integrated really well into decision-making, or by contrast, places where you've seen it languish and these gaps and chasms really not be crossed?
Well, I'll cover that maybe a little bit in the next piece of this presentation when I talk about some of the primary research we ourselves have done, some surveys we've produced in partnership with the COVID Collaborative. We did, for example, a very extensive survey of Black Americans and their vaccine hesitancy. It's been a group of particular interest because they're at the same time particularly hesitant, yet also particularly vulnerable to the disease. So we did a survey focused on vaccine hesitancy among the Black Americans last fall. That was used in the initiation and creation of a $50 million ad campaign by the Ad Council, a nonprofit public service organization in the US, to promote vaccine uptake in these hesitant groups, particularly among Black and Latino Americans. So that's a really good example of research of this nature being used in a very clear way to influence efforts to drive public attitudes and behavior. Indeed, I don't know if you guys watched the Super Bowl, but you might have noticed there weren't any Clydesdales on it this year. And that's because Budweiser issued a statement committing the $25 million that it would have spent on advertising the Super Bowl to be spent instead on addressing vaccine hesitancy among underserved populations. And Budweiser cited the very study we conducted that I just mentioned. So sorry about the Clydesdales.
That's the kind of impact that many of us can only dream of having with our work, is to influence what people see during the Super Bowl. And I will say, we didn't mention during your introduction, but I believe you have won an Emmy, 2 Emmys related to the polling work that you did as well.
Yeah, that was an honor. I have in my career, I was director of polling at ABC News for most of 20 years. I received 10 Emmy nominations and 2 Emmy awards. Those were for a 7-year series of surveys we conducted and now analyzed in Iraq and Afghanistan.
So I want to pick up on that thread of the power of public polling in some ways. I'm curious about the way that public opinion researchers think about sort of following the currents and the themes that are already in conversation versus agenda setting. And I know this is an issue that it varies a lot from firm to firm, and we've had disparate answers when we've talked with Pew and others on this. But COVID opinion polls, for example, have the ability to shape how conversations are structured and how decisions are framed. And so I'm wondering if you can sort of tell us a bit more about how you think about that element of this and how others in the space handle that kind of tension.
Well, one concern I have about a fair amount of public polling, particularly news-focused polling, is that it does tend to be merely descriptive rather than analytical. And there's a lot more you can do with the data than customarily are done, right? We might see a report that says this many people have gotten the vaccine. This many people intend to get the vaccine. These groups are particularly disinclined to get the vaccine. But we don't often get the kind of insight we'd really like to have into how and why those conditions exist, right? Going from the descriptive to the analytical is a really important element of this research. Now, these organizations are doing really strong data collection. Of course, they're asking different questions often, and that's important to see what we learn from different questions. It's not contradiction when you get different results. It's just additional information that we have to pick apart. When we have these data sets available to us, now we have rich opportunities to go in and go deeper into the data, to organize the data sets, to do some recodes, to do some modeling. We do a lot of modeling in our shop, OLS regression analyses, and the rest to try to determine some of the motivators of the attitudes and behaviors that we're so interested in. And I think that's a place where academic researchers and others can really make great use of the good work that's being done by taking it that extra step further. I don't know if that answers your question, Eric, but I think that's one piece of it. I don't know that surveys drive conversations. I think they're intended more to track conversations, but they can do more than just track them. They can inform our judgment about what the public in all of its diversity is bringing to the table in the attitudes and behaviors that we care so much about.
Really interesting stuff. Thank you. On that note there, I'm curious if you think that from your expertise in cataloging these thousands and thousands of items, do you think that there have been issues that have been either overrepresented or underrepresented in the polling research throughout the materials that you've cataloged in Sean? Are there places where you'd like to see more or less attention or refocusing happen?
No, I think that there's always more in the data sets than get out initially in some of the reports. And that's why we can dig down deeper. We recently produced a detailed analysis of vaccine attitudes among evangelical Christians and among conservative Republicans, right? In which case, we're using the same variables that were present in some of the data sets that we produced, but we're drilling down even farther and farther into these individual populations. It's interesting to look at urban and rural and suburban residents, and look at the differences among those groups. But we really need to pull apart what's driving those differences. I think that in terms of the breadth of the questionnaires that we see, the topics that are covered, it's really very thorough. There are just so many surveys being done on these topics. I don't find any of them to be trivial. There's a lot of overlap, but I think that's fine. They're done at different times. To some extent, we can net data sets, aggregate data sets to deepen our analysis. And as I mentioned earlier, we can learn from different questions. There are some surveys that ask you if you're going to wait and see before getting vaccinated, but they don't ask how long you want to wait and see. And others that do ask that question, and I think have produced some eye-opening and useful, important results, particularly when we look at those results among these different population groups. Some surveys, I didn't mention the University of Southern California survey of Americans' coronavirus attitudes. That's a rich survey for a variety of reasons, but one is it gets per wave, and I forget which wave they're up to, but there are lots of them, 6,000 interviews. So you can really dive into that many cases, and there is a lot of strong secondary analysis that's been done on this USC data set. So again, the notion that a survey gets done, it gets reported, and we move on, I think is a real loss, because these are rich, full data sets, generally created with a great deal of care and methodological rigor. And there's much more we can drill out of them once they're available to us. And that's the whole point of the Sean effort.
Yeah, absolutely. And I think in many ways, this talks about the importance of open science and open data that unfortunately sometimes is slow in academia come on board with us. And so we'll talk about Sean here in just a second. I guess the last question I have on the broad topic of public opinion research on COVID is whether you've seen any evolution or learning in terms of how things are done. Have you seen places where we learned lessons from early in the crisis and are doing a better job with the polling or surveys now, or places where it would have been nice to have more information earlier on?
Well, a few things. One is, I mean, just there's been some adjustments that have been necessary. So there were days particularly earlier in the pandemic when the shutdowns were in place, that the staffing of the survey research call centers was problematic. And a good number of the organizations that we're aware of and worked with that were doing telephone interviewing set up VPN systems in which their interviewers could tunnel into their dialing control systems from their homes. And supervisors would also be able to monitor remotely. So we maintained supervision. We maintained the sample control, and this quality assurance and quality control were still in place, but that was with that technological adjustment that was necessitated by the virus. Elsewhere in the world, of course, where face-to-face interviewing has been the norm, there's been greater problems in carrying out that sort of research. It's continued in some places, it's coming back in others, not yet in some too. I think there's been efforts to find alternatives, but the reason largely that face-to-face was being done in those countries was because they weren't ready for telephone work quite yet, and that may still be the case in many of them. So these are some of the sort of the data collection issues that have come up and largely been dealt with. As far as the surveys themselves, I think we've gotten some beautiful trends. We've got a lot of these organizations that have been asking the same questions over time, and we can track them in really enlightening ways, yet at the same time have adjusted their instruments to reflect what's been going on, right? We're not seeing so many questions now about closings. We're seeing more questions about openings. And of course, since December, we've seen a great surge in questions about vaccine uptake. That's appropriate. It's a matter of critical concern. We weren't talking about variants and the risk of those a few months ago even, but we certainly are now, and we can find survey research on those as well. The beautiful thing is, I don't think you can imagine a topic related to the pandemic on which data has not been produced.
Absolutely. And I mean, as a shout out to some of the group members here, even just within the working group, it's been intriguing to see topics from Antarctic research and COVID through to vaccine uptakes with certain populations being covered by the work being done. So I very much agree with that. Look, before we shift to the work that you've been doing on your own project, I do just want to get a little bit more into Sean, because you were alluding to some of the elements of rigor that you really strive for in what's included. And so I'm wondering if you can tell us a bit more about the inclusion criteria, how things are selected, and how you define some of those terms around the probabilistic sampling and sample sizes and things like that.
Yeah, sure. And I think, if you don't mind, let's just do this real quick and just jump in while we're talking.
Absolutely.
All right. If I scroll down, we're back on the Sean page, correct?
Correct.
Here's the contributor's guide. Let's just pop that open. It's got a pretty good description of what we're looking for here. We archive surveys, just to read it out here, that are based on sampling frames that include all or nearly all members of the target population, sampled so that all units in the frame have a known non-zero probability of selection. Probability sample, a random sample. We explain here why we use this as standard, because our reading of the literature tells us that it's necessary to support inference. We think that important issues require serious data. And serious data, again, from our reading of the literature, remains probability-based data. We describe the materials we're looking. So what we do, we have a curated archive. We don't just take any survey that comes in over the transom. Any survey that's proposed to us for inclusion in the archive, we look it over. Now, we can't do a full bore vet. There are nearly 1,000 surveys in there. You could spend many hours checking out each one. We look for methodological statements that seem reasonably complete. and adequate to support the requirements of inference.
And can you just tell us a bit more about, so you've identified these, they're submitted in. How do you do that hard work of synthesizing into the reports and of ensuring that the data is transposed correctly into the database here?
Yeah, it's pretty labor intensive. This project has been somewhat of a labor of love. One thing is the Park platform. We already have this Park platform. We license it out on a subscription basis, and a lot of survey firms use it either for their internal management of their files or for stakeholder or public-facing functions. In many cases, all three. If you think about it, you're at a survey shop and the phone rings and somebody wants to know the last time you did a survey on drunken driving, and you look at each other and didn't we do, what was that, 3 years ago with Bob ran that, he left. You can't find anything, right? And institutional memory is not a system. So the whole purpose of Park is to put this material at your fingertips. Since we had that anyway, and we're making it available to many subscribers, when we were contacted by the National Science Foundation asking about ideas to help get social and behavioral research out to the world related to the pandemic, Park seemed like a natural fit. So it's a very functional system. If we've got a reasonably clean analysis, a top-line data report of your questions and your results, a scripted questionnaire, it just uploads quite simply. We have a lot of different subscribers who use a lot of different formats, yet they all get their stuff up there with no trouble. When you have a Park account, you just see your own stuff. This being a public-facing account, of course, we make it open to the world. We do have a couple of people on our team who are charged with cleaning that stuff up. If and when necessary, we'll upload it, see how it looks, make sure it's good. One of the seniors on our team is just a brilliant researcher, Julie Phelan, PhD in social psychology, who drives the boat, and she's responsible for keeping track of each week's summaries, and then with some help sometimes from others on the team of each week's surveys, and then first drafting the summaries. We do some editing across our team and send it out each week. Also, we fairly exhaustively number check. You asked about that as well. So we have a couple of sets of eyes on everything we put out, making sure every data point is correct. I think we've been clean so far.
And I'm just so glad that you've been willing to share and come in today. I will admit a small personal anecdote in all of this was that as we saw this deluge of surveys in the Canadian context in early 2020, very briefly, my lab decided it would be a good idea to put together a similar kind of tool in the Canadian context. And I cannot overstate how much work it is to build something like this. And so the work that you've done with Sean here is just an incredible resource. Needless to say, ours did not stay off the ground for much longer than the Wright Flyer airplane, but to have access to this resource and for the researchers who are listening on this call or watching later, or for students watching this later on too, I think this is an incredible resource to be able to find the data that you need and get in there and do those kinds of secondary analyses that you talked about. So just a fantastic and fascinating platform.
Thanks, Eric. One thing I'd mention too, too often we sort of think, well, we've got a great idea, we can reinvent the wheel and just start over with some. We're going to do a survey on masks or vaccines or social distancing or you name it. We do so much better work when we stop to see what's been done before us and learn from what is out there. And I think the Sean Archive is really intended for that purpose. Not only can you analyze the existing data in the system, but if you're designing your own survey, you're going to do a survey on social distancing or on vaccines or mask wearing, go out, dig in and see what's been asked previously, see how differently it's been asked, what different results have been obtained. And you can really learn from that in designing your own instrument, whether you're going to replicate or simply take ideas from them.
Couldn't agree more. And I would really like in one of the upcoming conversations to talk a bit more about the pilot testing element of this too, because I think it's an underemphasized component of a lot of survey research, particularly in emergency contexts. And so hopefully we can dive into that in a future conversation too. Shall I pass things back to you here to continue on with part two and talk about some of the primary work that you've been doing?
Let's do that. Just going to hit the share. Are you seeing that now? Sorry.
Not yet.
Okay, give me just another second. Bear with me. I'll do the screen share. And here we go. We good now?
We are indeed back to the slideshow.
Perfect. Okay. So this is primary research we've done with the COVID Collaborative. The aims initially, the first assignment was to deeply evaluate vaccine hesitancy among Black Americans, as I mentioned, determine its motivators, and develop recommendations to encourage uptake. Further, we came back with them to track vaccine uptake and hesitancy among all adults in the country, some Gen Pop studies, model its predictors to inform messaging campaigns, and then most recently to study vaccine attitudes in American Indian and Alaska Native communities, a really understudied population. The first study, the first study about Black Americans, we started with an extensive literature review to see what was known about both vaccine hesitancy and health equity issues involving Black Americans and also the Latino population. We spoke with some experts in the vaccine hesitancy and health equity field who were very helpful with their recommendations and their questionnaire reviews for us. Overall, I'm going to, I think, talk chiefly about our Gen Pop studies about vaccine uptake and hesitancy among all Americans. Key findings is that in encouraging vaccine uptake, stressing safety and effectiveness, support of loved ones, and community responsibility are the surest ways forward. We get there through a regression analysis we conducted, a very informative analysis, I believe. First, focus on safety and effectiveness. Seeing the vaccines as safe and effective is by far the single strongest predictor of uptake in our regression. Establish a subjective social norm. That means encouraging people to understand that others close to them want them to get vaccinated. That was, in our work, the second strongest predictor of intended uptake, with a lot of room for improvement on it. Another is to stress social responsibility. There's the understanding that getting vaccinated is necessary to help the community rather than just a personal preference. This moral norm, again, if it's not universal by any means, and it's another very strong predictor of intended uptake. And then another predictor is perceived disease risk, making sense. And of course, in accord with literature, the more worried you are about catching it, the more likely you are to get vaccinated against it. If we look at some of the data here, when I talk about some of the shortfalls, in this data from earlier this month, completely or mostly trust that the vaccines are safe is 56% of the population. That leaves a very substantial minority who are not so sure about that. Trust that they're effective, same deal. This perceived social norm, the understanding that those close to you want you to get vaccinated, a really important element of intended uptake, and one that we can work with and encourage. A substantial number of people don't subscribe to that social norm. Similar again for the moral norm. 42% of Americans think that getting vaccinated is merely a personal choice, not a community responsibility. These are the sorts of things, the insights that we can draw from these data in ways that we can now think about ways to try to address and deal with these. Just for example, after you get your shot, you've bought in, now you have to sit in a chair for 10 or 15 minutes to check for any adverse reactions. What a beautiful time for someone involved in the vaccine effort to come up to you and say, great that you came in and get your shot. Now go encourage your friends and family to do the same. Here's some literature to take with you. You know it's important. That's why you came in today. Spread the word. That's a good example of how we build that social norm and the moral norm as well. Here's the, I figured for this audience, we can share a regression output table. The first is just a demographic model, and then our full model, including the attitudinal variables I just mentioned. You can see the beta here on trust and safety and effectiveness. It's really the heavy hitter in the model and can't be stressed enough, but also the subjective social norm, the moral norm, perceived disease risk are really the heavy hitters in vaccine uptake intention. There are some concerns that come out of the data. Uptake is largely confined to those who are favorably inclined. Hesitancy has been persistent, about 3 in 10 Americans, maybe down to a quarter now, with 1 in 10 outright refusals. Half of the unvaccinated have taken a wait and see stance, including 16% who are inclined to wait a few months. That's not a short while, and 21% longer than that. And hesitancy is, we've seen discussed peaks in particular groups: blacks, conservative Republicans, white evangelicals, largely given the factors I just mentioned: weaker recognition of subjective social and moral vaccination norms, lower trust, and in the case of some of these folks, conservatives and evangelicals, a less expectation of or worry about getting infected in the first place. These show some of these results. The green bars are white evangelicals, a particularly hesitant group. The second bar, the green ones, are also evangelical Christians, but those who are racial and ethnic minorities. And then the blue bar is everyone else. And the first set shows you either the number who've been vaccinated or inclined to do so. You can see the gap between white evangelicals and the everyone else bar is 24 percentage points. It's really quite enormous. If not yet vaccinated, but inclined, you can see the gap there. And then the last set of bars is the refuseniks, people who say they will not get vaccinated. It's 10% of everyone else, but it's 30% of white evangelicals. So I think these are enlightening and concerning findings. If we look here, this compares all conservative Republicans is the green bar, and the not conservative, everyone else is the bar next to it. The first set completely or mostly trust that the vaccines are safe. You can see the difference of conservative Republicans, 51% only versus 63% everyone else. The next set, evangelicals and non-evangelicals, a huge gap there in trust and safety. The next is the subjective social norm that you think people close to you want you to get vaccinated. You can see the gap between conservative Republicans and others, and the even bigger gap between evangelicals and non-evangelicals. And finally, the moral norm of a social responsibility or communal responsibility. It's got some of the biggest gaps we see between these groups. Lastly, when we look at Black Americans and Hispanics as well, with their history of unequal treatment, I think, in the medical system in this country, a trust among Black people that the vaccines were adequately tested in their own community is pretty weak, as it is among Hispanics as well. When we can uncover these sort of sentiments, it gives us ways to try to help increase understanding and to try to address these concerns that we've measured. That's a quick summary of the research we've done. I'd like to say that all of the reports I've just described and all the data sets are, of course, available in the Sean archive.
That's a great teaser to get people to dive in and dig into some of the material that's available there, and really interesting results that line up and feed lots of the conversations that I know people watching right now and part of our community here are paying attention to and trying to research in their own contexts. I'm curious if you can tell us just a bit more about sort of beneath the hood on this, in terms of the sampling methodology and how you went about recruiting folks for this particular study.
Well, so these the studies I've just described were done using the Ipsos Knowledge Panel. Knowledge Panel used to be called, back in the day, is Knowledge Networks. It's a company that was founded by a Stanford University professor named Norman Nye back in the late 1990s. And the notion there is that you can conduct surveys online, but not with a self-selected sample, the way most online surveys are conducted with the convenience sample, as it's called. I can share a link to a report. We summarized the independent academic research on convenience sampling, online convenience sampling. It's also well covered in the APOR report that I mentioned earlier that's cited in our contributors guide at Sean. But the data show pretty clearly that these convenience data don't produce valid and reliable results. You get a lot of inconsistency across panels within a single point in time. And you get equally as much inconsistency within a single panel across numerous points in time. But they don't seem to have stable estimates. And probability theory would indicate why, because we need a random sample to support inference and to give us valid and reliable data. So this was Norman Nye's insight back in the day, was that we can assemble a probability-based panel to take surveys online. What we have to do is have a different means of recruiting people to join the panel. And he used to use telephone interviewing, but for many years now, the knowledge panel has been recruited via address-based sampling, a very robust random sample method. Just about everybody in the country has a postal address. We can get those postal addresses, randomly select from them, invite people to join the panel. Another important element is that the panel membership is open to those who don't have internet access or appropriate devices, because they're provided them at no charge. So the digital divide of the non-internet ready is addressed in panel membership. And once you're in the panel, you fill out a pretty extensive profile survey listing a lot of information about yourself and others in your household, which then can be used in the future to randomly select based on various attributes if you want a specific population group, or we randomly select from the full panel for participation in a general population survey. They care for the panel quite closely. They don't overburden them. Participants, I don't think, get more than a survey every couple of weeks, and they're compensated with token gifts or payments.
The points you're raising here are really important, and they can sometimes go a little understated from conversation to conversation in the seminar series, because sometimes these panels look very similar in the marketing and public facing side of them with the online panels, but the methodologies of, I mean, when we talk to Pew Research and how they recruit their members for that versus some of the commercial providers can vary quite a bit, which propagates into really important differences in who's responding to the survey when you ask them.
Yeah, well, Pew itself has its own probability-based panel in which they conduct US surveys. It so happens that the knowledge panel, currently owned by Ipsos, Ipsos also manages the Pew panel for Pew. There's a lot of work in managing a robust panel, as you can imagine, and Ipsos has got a specialty in that at the moment. The knowledge networks was sold to GfK, and then from GfK it was sold on to Ipsos a few years ago. They do a good job. There's others out there. The NORC, the National Opinion Research Center, University of Chicago, has a similarly designed panel called Amerispeaks. It's not quite as large, but it is probability based as well. And look, there's been a lot of independent research about data quality out of these panels. The Amerispeak panel, the Ipsos Knowledge panel have been very well vetted, have been published in many peer-reviewed journals, and I can say from my own experience, do produce a good, strong, robust data, as do still telephone surveys in this country. We have very strong results there as well, also random sample. The key is the probability basis of this work as far as we can see.
Speaking of that aspect, I mean, that always comes into conversation as you deal with some of these subpopulations that are very hard to reach. So in the Canadian context, that for us often means territorial residents, Indigenous communities, different racial communities, and the like. I'm curious what strategies either you directly have used in this COVID-specific research to make sure that there's good representation in those groups, or promising strategies that you've seen from other COVID research on the topic.
Well, so there's two things. One is, if you just want representation of population groups to their actual proportions in the population, you're pretty well assured that through probability sampling, right? We do need, in random sampling, we are expressing belief in the sampling gods. If you draw a random sample, it will, through the nature of probability sampling, reflect plus or minus pretty accurately the population composition that's really there. The challenge is if there are small population groups that you want to oversample because you want to analyze them separately, you might not have enough, right? So if you're looking for an indigenous population group, and let's say it's 1.6% of your national population. I don't know that that's the case, but actually it is in the United States. That's a really small group. So if you do 1,000 interviews, there's not a lot you're going to do with that 1.6% who are in that population, and you want to oversample. This is where these large probability-based panels can be really useful. we can use something like the Ipsos Knowledge Panel. It has 65,000 members across the country. Say we really don't want to do a general population sample. We just want to sample indigenous people. Well, we can look at the profile information and extract out of the 65,000 the indigenous population and just go to that population. So the utility of these probability panels in hard to reach population sampling is really pretty impressive.
One issue that's been quite contentious in discussions on these calls so far has been the topic of weighting. And I'm wondering if you can tell us a bit about how you approach that in this project and other advice or recommendations that you have relative to questions of weighting on GenPop surveys.
Yeah, so a couple of things. One thing, of course, is that the critical element in all the things we're discussing is the full disclosure, transparency. So however a survey is weighted, it needs to be fully disclosed. And there should be, as there are, I'd like to say in our reports, a detailed methodological appendix, not just some assurance that everything's okay, but an explanation of what weights were applied. We can, a really strong, rough and ready assessment of the impact of weights, of course, is the design effect. And we think it's really important to assess the design effect. It impacts the effective sample size and therefore impacts the margin of sampling error, as well as any assessment of power, any sort of power analysis you want to do. You need to know the design effect. I'll mention, just for fun, if we're going to take another minute, I'm going to do a quick, one more share screen. You can stand this, can't you?
Absolutely.
All right. Give me just a second. I want to get off this page. Okay. I'm going to just find bear with me just a sec. I swear I'm not doing a plug here. You see on the screen now, this is langerresearch.com.
We do.
If you go to the if you go to Mo here, margin of error, sorry, let me click on that correct page again. Come on, baby. All right. You can input your sample size, the PQ, the design effect, and it'll tell you your margin of error at various confidence levels. If you want to do that, comparing groups, you can do so here. Put in the size of each group, whether you've got two different waves of a survey or two different groups within a survey, the P over Q, the design effect, and the rest, you can do it here. We give our definitions, and we even tell you here how to calculate design effects. So this is a pretty useful tool, and I think the researchers who are hopefully watching, if it's not just you, me, and my mom, might find this pretty useful. One element is disclosure weighting. I mean, typical weighting variables can be age, race, sex, education. There may be others. It's really dealer's choice in what you provide weighting, but your weights should not really move your data around very much, because the whole idea of probability sampling is that by natural fallout, via the sampling gods, you're going to get good representation. So what your weighting should do is true it up a little. You get some shortfalls of harder to reach populations, right? Younger people, lower SES individuals, that sort of thing. But you should be in the ballpark, and then your weighting is intended to true it up. How do you know if your weighting is having a really big impact? You know it from your design effect. And that is critical to know, because if you're ignoring your design effect, then you're misstating your effective sample size. And if you're doing that, you're misstating your margin of sampling error and your power. How was that?
Thanks for that, and for the tool, which I'm sure will get some folks playing around with it in days to come. Look, we're almost out of time here, but I do have to ask one more question that I've just been grappling with a lot here, which is around your example of vaccine hesitancy and vaccine uptake here, and the challenges involved in measuring intended behavior. These obviously are complicated issues, and asking people to predict the future is a messy question at best. And so I'm wondering what your personal philosophy and ethos is when you come to designing and running these kinds of questions, and what words of advice you might have for people who are trying to deal with these challenging measurements around vaccine intent and travel intent and all sorts of other future behaviors.
It's a really good question, and we could do a whole nother discussion on pre-election polling, which tries to do exactly what you just raised, which is get people to assess for their intended behavior. It ain't going to be perfect. There are challenges. There can be barriers to action or disincentives to action or disproportionate incentives to action that can influence these things. The only thing worse than making our best guess as to intended action is not to try. Because even if it's going to be imperfect, there's going to be a great deal of correlation. And there's going to be a great deal of insight we can draw out by looking at the associations of the variables within the data. Whether or not we nail the estimate, we said, I told you 72% of people were going to get vaccinated, and it came out 78%. You blew it. That's not the point here. What are the relationships that are among the variables that are involved in that intention or not to get vaccinated? And how can we use that information to impact that outcome if indeed we care about it, as I think we should? So actually, the insights we gain from these data may change the outcome variable if we use them effectively, and that's fine. The idea here is not merely to predict the future, which does have its great challenges. The idea is to understand the underlying motivators of the action that will form the future, whether we like it or not.
Well, I've been biting my tongue all session in a number of our calls before this because I keep wanting to ask about what we should take away from US election polling and all of the debates and conversations there in the context of COVID. But I think the answer you've just given is actually a really helpful one, that in some ways the debates around precision of polls are perhaps not focused on the right question or the right utility of polling there.
Yeah, absolutely. I mean, if you think about elections, it's getting a little off topic, but there's one thing about any election that we will know in the fullness of time, which is who won. Right? So why would we do all this polling to find out something that we're going to know in truth anyway? Rather, how and why did this happen? What judgments did people come to in picking the policies and the leadership attributes and the candidate qualities that they cared about in determining whether to vote and for whom? Those are really fundamental elements of democracy that are useful and important to know, far above and beyond this question of who will or did win.
Well, Gary, thank you so much. I really appreciate you taking the time with us today. I know those who are watching live enjoyed it and hopefully benefited from it a great deal. And I will have this resource open in the spirit of open data. This will exist as a teaching tool and as a material that can be used by folks for a long time to come. So thank you so much for taking the time and being part of our conversation today.
Thanks, Eric. And the last word, I'm G. Langer at langerresearch.com. Anyone's got questions, drop me a line.
Excellent. Well, in the ongoing series, we're going to change gears totally and get a very different perspective next week when we have guests from NYU joining us to discuss social media-based polling and the way that Facebook data collection has been rolled out for very large-scale surveying of COVID symptoms and other topics. So we'll get a deep dive into a world of a radically different approach to sampling than the one we've talked about today. And hopefully we'll be able to carry some critical questions through from our conversation today into the discussions next week. With that, thank you so much for joining us in this conversation. For everyone watching live or in the future, stay safe and healthy and hope to see you again next